probably heard people talking about drugs like Ozempic to lose weight. You've probably seen the commercial or at least heard of it. Even though the medications are meant to treat diabetes. Well, now a new study suggests those drugs may actually go a step further, tackling things like addiction, as discussed last night on Elizabeth Vargas Reports here on NewsNation. Watch.
One patient who took Ozempic for a weight loss said it was like a switch had flipped in her brain, like all sorts of addictive tendencies vanished. What's going on, do you think? How is this working?
Well, we know that these drugs stimulate a receptor called the GLP-1 receptor. And these receptors are in the brain, in the reward center, in the hippocampus. And so by stimulating them, they may actually reduce the reward gleaned from these kind of addictive behaviors.
All right, here to break it all down is Dr. Saju Mathew, a primary care physician and public health specialist. He is based in Atlanta. Doctor, thanks for being here with us on NewsNation Now. Appreciate it.
Excited to be here with you, Blake.
Yeah, so I'm just wondering your overall thoughts on, correct me if I'm saying it wrong, semaglutide, and sort of the benefits here as you see it, and what exactly does this do?
I'll tell you what, I'm actually excited. As a primary care physician, Blake, I treat so many patients that are morbidly obese. I mean, 40% of Americans are obese, and we spend about $170 billion per year in obesity-related medical issues. So this actually might be a game changer. This is a medication, Ozempic, that works basically by mimicking a hormone in the stomach, but also talks to the brain so that it decreases the emptying of food from the stomach. If you have breakfast in the morning, by the time lunch rolls around, the breakfast is still in your stomach, so you're going to eat less. It's almost, if you will, like an appetite suppressant, but it also works in different parts of the brain as well to decrease potentially craving.
You know, I hear you, doctor, but some are going even a step further. For example, the potential benefits here include reducing heart risk, treating drug and alcohol addiction, preventing dementia, and fighting cancer. If it were to do one of those things on top of helping with type 2 diabetes, I think we would say, and most people would say, whoa. But that's a lot to put out there, is it not? Like, do you believe that this is some sort of potential super drug in the works here?
Well, I mean, I think we have to be careful. This is still a relatively new drug when it comes to obesity-related medications. And a lot of this information that you just described is also anecdotal. We don't have a lot of case control studies, which, by the way, I think we are going to get a lot of these studies in the next few months and years that might actually confirm. I had a patient the other day who said, Dr. Mathew, in addition to losing 20 pounds on Ozempic, I just don't want to drink alcohol anymore. This is the patient that was consuming 2 glasses of wine per night. We'll have to see, Blake, but I think that there are a lot of reasons to celebrate. This is the medication that is specifically for diabetics, but a lot of diabetics who ended up taking this medicine lost a whole bunch of weight as well.
Yeah. You know, doctor, I think you and I and most people would hope that some or all of that is true, but we also have enough history with medications to know that there's downsides and side effects. What are you seeing on that front?
A lot of nausea, vomiting, abdominal bloating, GI issues, but these are relatively tolerable side effects. Every now and then I may see a patient with pancreatitis, and that can be pretty painful. It's an inflammation in the middle of your stomach, severe nausea, vomiting. If you have certain conditions that predispose you to thyroid cancer, this is also a medication that I would be careful with. But ultimately, we need to make sure, as we see the graphics up there, decreased appetite, vomiting, a lot of GI side effects. But what I was actually going to say, Blake, is we also need to make sure that the right patient gets the medicine. Ozempic is specifically for diabetics, and then Wegovy, which is the obesity-related medication of Ozempic, is specifically for patients who want to drop the weight.
Yeah, interesting, though, to hear how bullish you are on this. Dr. Saju Mathew, got to leave it there. Thank you for joining us. Appreciate it.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.